Welcome back to the Pulse with me, Elton Brobe. Now, casual sex, multiple sex partners causing 74% of the country's HIV infections. That's very scary. Ghana Demographic Health Survey has this new information. Right, so let's talk about this. And the Ghana AIDS Commission, the Ghana Statistical Survey joins us in studio to brief us more on this matter. Mr. Godwin, you're welcome to the Pulse here on Joy News.
JB.
Yeah, Mr. JB, welcome to the Pulse here on Joy News. So this is scary. Tell us more about this. What people are just having indiscriminate sex, is that it?
Yeah, we thank you very much for Joy always supporting Ghana Statistical Service in disseminating our surveys and other products. Yesterday, or today, we disseminate some of our reports. And after doing the actual dissemination, we picking on key issues to throw more light. And today's one is on the HIV knowledge and all those things. So even though we made a statement about multiple sexual partners in the last 12 months preceding the survey, but then we didn't indicate that that is causing 74% of HIV infections, even though we made a statement on those who are into 2 or more partners, or those who have sexual intercourse with persons who are not their wives or husband, or they don't even stay in with them. And then with those people, the use of condom or the use of other means to prevent the high risk of having sexual intercourse with multiple partners. But then we didn't state that that is causing 74% of all infections.
So in terms of percentage, how much of it is it causing?
No, we didn't even...
You didn't come to that conclusion yet,
yes.
But it is a contributory factor.
Yes, definitely. Once you are at a high risk of having sexual intercourse without protecting yourself and having it with multiple partners, definitely you are contributing to HIV.
Give us a breakdown of the survey outcome.
Yes, so we even categorize the youth. You know, the youth are very, what is called, they form the bulk of the population. So even we look at them, for them, 15 to 24 years, we identify that 3% of them have 2 or more partners.
15 to 25 years.
24 years.
15 to 24 years.
Yes. 3% of them have 2 or more partners.
Female or males?
That is women. That is females. Then the male is 9.9%. So we see that the male, those who have 2 or more partners, they are about 3 times higher than that of the females, what is called 15 to 24. Then again...
So basically between the ages of 15 and 24, people in this category, they have multiple partners.
Yes.
Male and female.
And that forms the 3% for females, and then 9.9% for the males.
Meaning the males are keeping more.
Yes, right. So that is how. Then again, one thing we also did was that, you know, there is a national HIV/AIDS strategic plan, 2021 to 2025. So we picked the figure for 2022 because the DHS was conducted in 2022, and then we compare. So for that one, the strategic plan, the target is that we should have 2.2% of the population, 15 to 24 years, that is the women, to have multiple partners or 2 or more partners. So we had 2.2, meaning that we didn't meet that target of the 2.2 because we did 3.0. The male, the target is 7.7. Then
almost maintaining the same outcome.
But then we hit 9.9. So you see that our target, we're not able to achieve it. There's a deficit.
Right. But tell me, why are they keeping multiple partners? Did you find out?
No, we didn't ask that question, why they are keeping multiple partners and all those things. You know, we're asking questions about the HIV, their knowledge. Then we see the behavioral issues relating to having sexual intercourse, whether you have one partner or you have two or more partners, because they all have implications as far as our HIV is concerned.
What are the other findings?
Yes, we also what is called look at those who had sexual intercourse in the last 12 months with persons who are neither their husband
or
wife or they don't live together.
Cohabitation.
Yes, this one is non what is called habitation or something like that, but they don't live together like any other partner. So for that one, when we look at the women 15 to 24, the figure is 34.2%, meaning that such women had sexual intercourse with persons they don't stay with. Mm-hmm. That of the men is 35.2. Again, there is a target for our strategic plan. We're supposed to do 29.6 for women, but we ended up doing 34.2.
So it went higher than your target?
Yes. So meaning we still have to work more so that we'll be able to hit our target set for the National Strategic Plan. So we also look at those having multiple partners and the use of condom. Because
or contraceptives?
Yes. So, no, condom in particular.
Okay.
Yes, because that will protect you from getting an infection. So that one too, we're supposed to, for the what is called the women 15 to 24. Yes, it's 23%.
23 don't use condom.
They use the condom.
Okay.
It's supposed to be 100%.
Right.
So we ended up only what is called 23. So about 77% did not use the condom.
But are they aware of the existence of female condom?
Yes, they are aware because the Ghana East Commission and other partners, the National Youth Control, this thing, they have been what is called promoting the use of condom, another preventive mechanism to help reduce infection.
I'm interested in the outcome of the males in this category.
Yes, for that one they are 34.5, so it's higher than the women.
Meaning more people are having sex without using condom.
Sure. Yes, that is the issue, especially those having multiple partners. Okay. They don't use the condom as it's supposed to be.
And then quickly run us through the other findings.
So the one particular thing too is the testing of the HIV for pregnant women. As they go to the antenatal, they are tested. So we have a figure of 67% of the women who go to the antenatal care for testing. Once you go there, you're tested, and then we have a figure of 67%. So that is a 2022 when we conducted the survey. That is what.
And in this regard, are they told before the testing, or it happens as soon as you go to the antenatal
once
care?
they are told, and it's part of the program for the antenatal.
All right.
Once you visit, then again, we also wanted to find out those who have ever tested for the HIV, and the figure is that 54% of women aged 15 to 49 indicated that yes, they have ever tested for HIV and then also received the results, compared to only 24% for men.
Men don't like testing for HIV.
Yes, so that is the figure: 54% for women and 24% for only men.
That's very interesting.
Yes.
But in the previous...
And then also another interesting thing is that, the HIV, the testing shouldn't be just once. It should be continuous. So we also asked whether in the last 12 months, whether you tested. And out of that, 15% of women indicated that yes, they have tested within the last 12 months. But a figure of only 7% for men who indicated that they have tested.
This is quite serious, if you ask me. So, but what is the end game in this?
So the end game is the continuous campaigns, education, for us to do what is called the testing and all those things. Yeah.
But the people you spoke to, are they aware of the dangers of HIV and AIDS? Are they aware of its existence, or there is a feeling that it's become like malaria or any other infection that can easily go away?
Yes. So we asked whether they've heard of HIV. Then some indicate that yes, they've heard, and others to say that they've not heard. So then another critical issue is the knowledge of HIV. Mm-hmm. So we asked that question to what is called the respondent, whether they've ever heard of what is called treatment for a particular treatment for AIDS. Yes, some indicated that they've heard. Others too said no, they've not.
They don't heard.
Yes, and then there is this discriminatory issues relating to HIV. Mm-hmm. We wanted to find out whether we discriminate
against people living with HIV and AIDS.
For example, some are of the view that they don't agree to children who have HIV to be able to attend the same school with those who are HIV negative. But in our country, we're looking for inclusive education where we all sit and then move on together. So a sizable proportion indicated that no, they don't believe that it is good for children who do not have HIV/AIDS to
be in the same classroom with them.
Then again, also the sale of vegetables, whether you would like to buy a vegetable from somebody you know or a shopkeeper you know that person is having HIV. Then also there are other discriminatory attitudes towards persons with HIV. So all these things we put them together in our report, and also to drum home on the need for us to do well in order to be able to live together. Also help those who are not well. When you take the SDG Goal 3, the well-being and then good health, it indicates that yes, we should all have good health. And then also, so once we discriminate, it's like
making it difficult to even fight it.
Yes, there are issues.
Before I let you go, so what I mean, in terms of advice to the Ghana AIDS Commission, the Ghana Health Service, and to the general public, what will you say?
Yeah, so I think still the campaign should go on. People need to be educated, because if you look at the discriminatory attitudes, we look at the regional level, some regions are not doing well at all. So we still need to look for such areas and then continue with the education. We cannot rest. It should be a continuous process that is the reason why we are doing the Ghana Demographic and Health Survey to monitor the programs which we have in the country.
Okay. Mr. Jebi, thank you very much for passing through with us. Hopefully next week we'll have the opportunity to go through other sectors of the survey outcome.